Harlan Sablisky, and today I'm going to be talking about exercise testing and prescription for individuals who have been diagnosed with breast cancer and who have also had a mastectomy. So to begin, first off, a lot of this information can be found in the handout I've provided. My goal here is really to just highlight and go into a little bit more in depth on some of the information. So breast cancer is one of the most prevalent types of cancer affecting our population today, and it is the #1 cancer affecting women of all cultural and ethnic backgrounds. In 2007 alone, over 200,000 men and women were diagnosed with breast cancer, and in that same year, over 42,000 people died due to complications with breast cancer. So you can understand why it's such a problem in our society, and it's such a reoccurring thing. So what is breast cancer? Well, breast cancer occurs when cancer forms in any of the breast tissue, and this includes the glands for milk production, the ducts that carry the milk from the glands to the nipples, any fatty or connective tissue, and also any lymph nodes that may be in there. While breast cancer is most common in older and middle-aged women, even young men and women can get cancer, breast cancer. So here I provided just a simple anatomical picture of the female breast. I just wanted to do this to show you, these are the lobes, also known as the lobules or the glands where the milk is produced, and then the ducts. These are the most important parts that we'll be discussing. So there are actually multiple types of breast cancer. Some are more common than others. The most common type is ductal carcinoma, which is when carcinoma forms into the cell lining of the ducts. Or you also have lobular carcinoma, which is when the cancer forms in the glands that produce the milk. You also have some uncommon types like Paget's disease and inflammatory breast cancer, which kind of require their own presentation and their own limitations. So the progression of breast cancer can be broken down into 7 stages. If you want a full description, you can visit www.cancer.gov, and they have a really good description of all the stages and what each stage pertains to and form in terms of the cancer forming and metastasizing. But as a health professional, what we really want to be aware of is just to be aware of what stage our client is in whenever you're doing any testing and programming, because it's going to dictate what kind of treatment they're receiving. So for example, a person in stage 1 will probably only be receiving one type of breast cancer treatment, depending on what their physician says they need. Whereas a person in stage 3 will probably be on multiple types of cancer therapies, and which can all compound and add a bunch of extra variables to it. So some of these risk factors, I have some risk factors here to decrease risk and increase risk. Really what I want you to know here, to notice here, is these 2 factors to decrease risk, which is regular exercise and maintaining a healthy weight. As health professionals, this is going to be the areas that we can impact the most. So I've provided some genes associated with breast cancer here. Now, in a normal individual, these genes would actually work to prevent types of cancer, but due to mutations or diseases, they may not be working correctly due to some abnormality and lead to the formation of breast cancer. And I just want you to be aware of them in case you're communicating with the individual's physician or therapist and they throw out some words you might not understand, so you just want to be aware of them. So the other part of this population is a mastectomy. So what a mastectomy is a simple common surgical procedure where they remove the entirety of the breast tissue to prevent or cut out any kind of breast cancer. This can be done in multiple ways. It can include the removal of one or both breasts. And it can also be a total mastectomy, which is whenever they remove all breast tissue, including the nipples, or it can be a subcutaneous mastectomy where they leave the nipple intact. The most common thing you're going to worry about when you're working with somebody who's had a mastectomy is a condition called lymphedema, which is when lymph fluid builds up in the soft body tissue, usually caused by obstruction of the lymph nodes, and in this case it's caused by the removal of them. And if they experience any of the symptoms associated with lymphedema, such as swelling and itching and hair loss, you'll want to refer them back to their physician. So managing the medications and treatments for this population can be very challenging simply because there are so many. There are over 200 medications used to treat cancer and its symptoms. And they can be used in really any kind of different combination. So you really want to communicate with the individual as well as their physician and therapist just to know what medications are on and how that's going to affect their exercise and functional capacity. You'll also want to be aware that individuals who have had a mastectomy may have issues with depression and anxiety. So I just want to talk a little bit about the treatments. You got chemotherapy. This is when medication is used. The biggest thing you're gonna see here is fatigue, which can create a large barrier to exercise, as well as other side effects. So next we have radiation, where you use, of course, higher doses of radiation to kill cancer cells. And again, here you're going to see a lot of side effects, but the main one that you're going to be dealing with in terms of exercise will be fatigue, because if they have any of these other symptoms, such as radiation dermatitis, inflammatory response in the lungs, you're going to refer them back to their physician before you do any kind of training. And lastly, we have hormone therapy. This is used mostly with prostate and breast cancer, and it's basically used to slow the development of cancer that requires hormones to grow. And again, you're going to be looking for fatigue. This is going to be the big barrier to exercise for this population. All right, for exercise testing. So as long as you take into account that each individual is going to have their own specific limitations, exercise testing is appropriate and often very beneficial for this population. And you also want to be aware of any chronic diseases that they might have, because this population tends to be older. So when you're doing this, you want to use, in most cases, you can use standard exercise testing protocols. However, you want to watch for extreme deconditioning and balance issues. Special considerations, watch for changes in any ECG, because they have a higher risk of coronary heart disease and other cardiac issues. You also want to be aware of increased risk for fractures, cardiac events, and neuropathies as well. All right, so when you're testing when you're doing aerobic testing, you want to use submaximal staged testings. Ergometer cycle tests are usually tolerated well and kind of take out the problems of balance and gait. And you also should be aware that due to the effects of radiation, VO2 may not be the best way to measure aerobic capacity. So endurance testing, pretty simple. You simply want to have them do a 6 to 12 minute walk, measuring the distance walked until volitional fatigue. This is a very easy test to do for even the most deconditioned individuals, and it correlates well with improvements in their functional capacity as well. Strength testing, generally safe with this population. You just want to adjust appropriately for any physical limitations and assess the strength and range of motion of their arm and shoulder due to the mastectomy. Flexibility, functional neuromuscular testing. Use normal protocols using goniometry and sit and reach test. For the functional neuromuscular test, you want to evaluate their balance and gait, and make sure they can move through certain ADLs with good independence. So, moving on to the actual programming. Again, this is very highly individualized, and you want to remember that variables such as disease remission, recurrent disease, or full recovery are going to impact your goals, and it's going to impact how they react to the training. So special considerations, the big one is fatigue. This is going to create a large barrier. This isn't fatigue like most people know. It's a very bone deep weariness that can really prevent any kind of physical activity at all. You're also going to want to know that even from session to session, performance is going to vary greatly due to the different treatments and their effects on the body. All right, aerobic training, very simple. You want to start out 3, progressing on to 5 days per week at a moderate intensity. You want to start at 20-minute sessions, building up to 60-minute sessions. And your goals should be to maintain body weight, improve mood, reduce fatigue, and improve quality of life. Strength testing, 2 to 3 days a week. Different types of resistance training is best. Circuit trainings, resistance bands. Keep it about 40 to 60%. They're 1 RM. And start out at 3 to 5 reps while building up to 8 to 15. The main thing to remember here is when you're first starting out with this, for at least the first 16 sessions, you're going to want to watch them very closely and start at a very low resistance. Flexibility and functional training can be done pretty much normal protocols. They can be done pretty much every day of the week. For flexibility, you want to go for 2 to 4 stretches, 2 to 4 times for each stretch. And you want to hold each one for about 20 to 30 seconds, going through a full body range of flexibility training. And for functional training, you just want to work on balance exercises and just basically to maintain and improve independence at home. So psychological concerns. The psychological concerns for this population vary greatly, with some people facing huge psychological problems, with some not at all. But this, as a whole, this population faces huge changes in body weight and body image due to hair loss, loss of control in their life, depression, things of that nature. So it can vary greatly and be a very large barrier. And you also want to understand that a mastectomy adds even more problems because, again, they're facing self-image problems. Something was taken from them. It's irreversible, so sometimes they have regrets. You just want to watch and understand that they have quite a bit of psychological issues. All right. So final words. When you're working with this population, you want to use normal protocols, except when you shouldn't. So how are you going to know when to not use normal protocols? Well, you're going to want to communicate. It's all about communication with the physicians, with the therapists, and with the individual themselves. And you also don't want to create unnecessary barriers to exercise through too much exercise testing or evaluations. And that's all.